Good morning, everyone. Bob Ravenscroft, the Vice President for Advancement, here for the September 15th, 2020 press briefing. First of all, kind of a non-related COVID topic. As if you follow the City Council, we are very pleased that last night, by unanimous vote, they approved the zoning annexation and all of the provisions that we want for future construction on what will essentially become the Bryan South campus. We cannot wait to show you plans for the Cancer Center. It's in the final design phases. So rolling out this fall, we'll certainly pull the media together and proudly share these exciting plans with you. Quick teaser for Thursday. We have a special guest coming. It is Kevin Hetmanick. Did I say that right, Brad? All right. Kevin is a practice manager for us at Bryan Urgent Care, and he's going to talk about some testing changes that are occurring out there, and they're kind of twofold. First and foremost, it's going to be better for patients because we don't want patients waiting for their COVID test results if they have strep or if they have something else. So he's going to talk through the processes of how we can get you right into a provider and assess your needs as it relates to testing. And then there's also a conservation component to it. I did just get something this morning, and testing supplies, they remain interesting. We are in a critical phase for our Veritor and our Luminix supplies, caution in our Cepheid, and then sufficient in our swabs and media. So it's something we continue to watch very, very carefully, and conservation measures are always top of mind for us. So anyway, with that, here's where our numbers are. We had 455 patients in Bryan Medical Center at midnight. We have now tested 21,775 or administered that many tests to people. Our positives have now reached 2,427, and we currently have 50 pending tests. Of course, our drive-through isn't open on Mondays, so it was interesting to see. We were actually down to only one pending test at the drive-through, which is outstanding. So the rest of them are the quicker turnaround ones that we're waiting on internally here. When we're talking about patients in-house, we now have 14 positive COVID patients in Bryan Medical Center. Only 4 are from Lancaster County and 10 are from outside of Lancaster County. There is an additional patient in-house also from outside of Lancaster County that is awaiting their test results, but they are hospitalized. We do have 2 patients on ventilators, one from Lancaster County, one from outside of the county. And of those, 4 of these patients are in our intensive care unit, 4 in our progressive care unit, and 6 in general care. Not in how people interact with us. Masking will still be required when you come into Bryan-owned facilities in all locations, and we will continue to encourage the things that we know work, which are social distancing, universal masking, and hand washing, and encouraging those communities to continue to participate that even with the relaxation of those. As far as making those that we are affiliated with or where we have a presence, we certainly have less influence, and I haven't heard what is happening at some of those. Edgar, have you heard anything going on in the critical access world? No. So Matt, we don't have really anything different other than what we know is going on in Crete and Merrick, where they'll adhere to Bryan standards.